Hi guys, myself Dr. Kumar Gaurav and today I will be talking about otomycosis. So otomycosis, ear fungus, is a fungal infection in the ears that seems to be a problem for people who live in the warm areas of the world. Avid swimmers, individuals who suffer from diabetes, or people who have a chronic medical and skin conditions can also experience ear fungus. Otomycosis is also called mycotic otitis externa or Singapore ear. The infection is generally present on the external part of the ear, while Aspergillus and Candida is commonly known fungi linked with the fungus of the ear, but there are other conditions, other fungi also. The infection is generally present on the external part of the ear. Aspergillus and Candida is commonly known fungi linked with the fungus of the ear, but there are others. But just come in contact with a fungi does not mean that you will get otomycotic ear. If you are having a weak immune system, you are at a higher risk of getting the ear fungus if you come in contact with the fungus. Now here you can see the otomycosis caused by the Aspergillus. Note the characteristic gray-black fungal elements on the debris. And here this is otomycosis caused by the Candida. And note the characteristic white fungal elements on the debris. Now the diagnosis of the otomycosis. If you experience pain, fluid discharge or hearing difficulty, you should visit a doctor immediately. The quicker you get a proper diagnosis, the sooner you can have a treatment and start feeling like yourself again. A diagnosis will only be made after a doctor has seen your medical history and conducted a thorough physical examination. Normally an otoscope, which is a device used to look inside the ears, will be used. A swab of your ear may be taken to send to the laboratory for testing. This test looks at the organisms under a microscope. This can help to find out there is a fungi involved and what kind of fungi it can be. Treatment is generally based on the type of fungi an individual is having. Now let's talk about the symptoms of the otomycosis. There are a number of otomycosis symptoms that can be indicate that you need to take a medical attention. Some of the sinus symptoms can be painful, but going to a doctor as early as possible can ease the discomfort both physically and physiologically. Here are some of the symptoms, and that are the pain, itching, difficulty in hearing, redness in the external section of the ear canal, and inflammation. The symptoms of the otomycosis: swelling, feeling of fullness in the ear, discharge from the fluid from the ears, white, yellow, black, gray, green, ringing in the ear, the flaky skin, the annoying of the external canal, the plugged ears. There are some instances where both the ears can have a fungal infection at the same time, though it is common for people who experience the symptoms in just one ear. When it does occur in both ears and the ears feels plugged, some people mistake the condition for going deaf. Well, what are the treatment options for the otomycosis? When someone has been diagnosed with otomycosis, their mind quickly shifts to ear fungus removal. There are 5 main ways the doctor normally takes to address the otomycosis treatment, and the list below explains them. The cleaning, the ear drops, the antifungal agents, aluminum acetate. So the cleaning the ear fungus from the affected ear can allow the better penetration of the treatments, including the ear drops. Well, some ear drop contains the antifungal agents and antifungal agents. Some antifungal agents are topical, while others, such as the itraconazole, are tablets. And these tablets are generally given in the severe cases. Then comes the aluminum acetate. This is a liquid that has been known to be very effective in treating ear fungus when it used at least 3 times daily for at least a week. Treatment of otomycosis: hydrogen peroxide. This can be used to soften the hard crust that builds up as a result of the infection. Extracting the crust allows the other topical treatments to focus the ear. Or oral medications. These medications are not for everyone, especially those who are suffering for liver disease, but some examples include the fluconazole and the ketoconazole. So for severe cases you can use it, but in the liver diseases basically you should avoid it. Despite the fact that most of the people think that antibiotics do not kill the fungal growth, In fact, they can make fungal infections even worse. So it is very important to know that cleaning the ear when you are having the fungal infection is not as easy as you might think. Ear fungus treatment is best when it is left to a medical professional. Thank you guys, and do subscribe my channel.